Ever heard of sexsomnia? Despite its name, it's not a made-up disease. Psychiatrists have confirmed its existence and the significant impact it can have on individuals and their relationships. Recently, there was a high-profile case in Sweden where a man facing rape charges was acquitted after it was revealed that he suffers from sexsomnia. Sexsomnia is often referred to as sleep sexing, where individuals engage in sexual behaviors while asleep without any awareness or recollection of the events afterward. In this case, the man had no memory of the incident and genuinely believed he was asleep during the act. It's essential to understand the nature of sexsomnia and how it fits into the broader category of parasomnias, which are sleep disorders that involve abnormal behaviors during sleep transitions. Parasomnias occur when the brain gets caught between the various sleep stages, particularly the non-rapid eye movement (NRM) phases. These stages precede rapid eye movement (REM) sleep, during which your muscles become paralyzed and vivid dreaming occurs. Sexsomnia occurs during NRM sleep when the brain is still active and muscle paralysis is absent. This allows people to move and act out behaviors, and in the case of sexsomnia, sexual acts while technically being asleep. It's important to note that sexsomnia is different from sleep-related sexual behaviors that may happen during REM sleep, when dreams are more vivid and sexually charged. This condition is relatively rare, affecting less than 1% of the population, but it can have severe consequences. Triggers for sexsomnia episodes include stress, sleep deprivation, the use of sleeping pills, excessive alcohol or drug consumption, and physical contact with another person in bed. It's worth mentioning that sexsomnia often coexists with other parasomnias like sleepwalking and sleep talking, making the diagnosis much more complex. Doctors first need to consider the patient's health history and look for any signs of these related sleep parasomnias before reaching a conclusion. Unfortunately, sexsomnia doesn't have a straightforward cure. The primary approach is to identify and avoid triggers, but this may not always be feasible. In severe cases, doctors may prescribe short-term treatment with medications like clonazepam or Klonopin, as it's known in the US, to reduce symptoms. However, benzodiazepines like Klonopin are one of the most highly addictive classes of drugs, and these drugs aren't a long-term solution. Sexsomnia can be devastating for those who experience it, as well as their partners or potential victims. It's important to raise awareness about this condition to promote understanding and empathy for those affected. If you or someone you know is dealing with sexsomnia, it's imperative to seek professional medical advice and support. Sexsomnia is a real and complex sleep disorder that warrants serious consideration. Its impact on individuals' lives and its role in legal cases underscore the need for increased awareness and research. Sleep disorders like sexsomnia remind us of the intricate workings of the human brain and the mysteries that still exist in the realm of sleep medicine. We hope you enjoyed this video. Until next time, sleep well.